Hello and welcome to your recorded webinar for the Healthy Minds Counseling Services Employee Benefits Open Enrollment for plan year beginning January 1st, 2021, going all the way through December 31st, 2021. My name is Bill Hammett. I'm proud to be your insurance broker. My phone number and email address are right here if you need to contact me throughout the year or during open enrollment to figure out what plan works best for you, understand the changes, find a doctor, really kind of dig into some of the parts that are important for you to make a good decision for yourself or your family with benefits. Also available, Tamara Pintado. She is my Rockstar Senior Account Manager. She's available throughout the year, also kind of more in an administrative capacity. You need a new ID card. You need to know the right number to call to get certain questions answered, basic claims issues, finding a doctor, that kind of stuff. So we're available to you all year long. This webinar is going to be embedded into the online enrollment portal, so you can watch it through there later on in the year if you need to. Quick agenda here. What is open enrollment? What are the important dates? Benefits changes? How do I enroll? And then, of course, questions and answers would be more geared towards you reaching out to one of us on that. But we are available for questions and answers. So open enrollment November 23rd to Friday, December 4th. This is our open enrollment period. You're all going to be asked to fit your selections into this period of time. Again, if you have questions, if you need some extra help choosing these plans, if December 4th is a little bit tight of a deadline for you, please reach out to me and let me know, or let Tati know, and we can work with you to get you to a place where you make a decision without feeling too rushed. Remember, this is the time where anybody's welcome to enroll or disenroll. You can change plans. You can add or remove dependents, whatever you want to do. This is your open enrollment period. Any changes that you do make, if you're already enrolled, they would become effective January 1st. For those of you that are enrolling for the first time with this benefit with the company, your benefits will go into place on January 1st, 2021. Another reminder that Friday, December 4th is our deadline, and we'll be completing our applications at our online enrollment portal called EASE. Reminder that after 1/1/21, in order to make any changes or to enroll or disenroll, you need to have a qualifying event. Qualifying event is something that is when you lose other coverage involuntarily. So if maybe you're on your parents' plan and you've aged out of that, or you're on a spouse's plan and they lost their coverage or whatever it may be, that's called a qualifying event and allows you to enroll or disenroll in the middle of the year. We have 6 plans available. Our HMO plans are through United Healthcare. United Healthcare's limited HMO network called Harmony. Harmony, what that means to you and me is Sharp Steely, Sharp Community Medical Group, UCSD providers. So that's where you're going to choose your primary care doctor. If you are someone that really loves Scripps and you want to use Scripps, then these 2 PPO plans, the Select Plus PPO Gold and Select Plus PPO Silver, would be a great option for you. And then there's kind of a non-traditional option, the HSA Bronze PPO plan, and we'll talk a little bit more about that in just a moment. Here's our HMO plans, all 3 of them side by side. Now, what I want to point out to you is starting up here at the top is deductible. So this Harmony Silver plan has a $2,250 deductible, whereas the Gold and the Silver or Gold and Platinum have no deductible. A deductible is generally what the insurance company is going to ask you to pay 100% of before they start paying any of their portion. All right. Now, there's lots of really important exceptions. Right here, this physician services window here. So $2,250 is deductible, remember? Remember I said that's what you have to pay before you get in benefits, remember? Well, that's not always true. There are some exceptions. Wherever you see DED waived, that means that you get this benefit at this copay from day one, $1. You do not need to meet your deductible. So if I enroll in this plan here and I want to see a doctor on January 2nd, it's going to cost me $50 for a general doctor, a primary care physician, if you will, and $90 for a specialist. Deductible waived, meaning I don't pay my deductible, I just pay that copay. If I need blood work or x-rays, $45, deductible waived. CAT scan, PET scan, MRI, $200 copay, deductible waived. Physical therapy, occupational therapy, speech therapy, $50, deductible waived. Chiro, $15, deductible waived. Doesn't say it there, but it is. And then down here at the bottom, urgent care, we have a $50 copay, deductible waived. So this silver plan, I say all this to help you feel a little bit more comfortable with this deductible, because for most of us, it's these regular things here, these, blood work, lab work, an MRI, maybe a physical therapy, a couple doctor visits, a prescription drug for $15. If you're on this silver plan, all of that stuff is covered without you having to touch this deductible. So that's important to know. Good value plan here. Out of pocket maximum, this next number here, 8,550, 7,000, and 3,500. What this means to you is this is the most that you would ever spend in the calendar year. So even though we have this deductible and we have all these copays here, once you've spent in total with every copay and every hospital stay, surgery, emergency room, urgent care, tier 1, 2, 3, 4, generic, brand name, generic drugs, physical therapy, chiro, MRI, whatever, the most you would spend is 8,550. Now, where you would really get to that number is down here on the hospital and emergency services. So you see it says 40% after DED, after deductible. What this looks like is if I have this plan here and I have an accident and I'm in the hospital for a month, I'm going to pay 100% of the cost for the first $2,250. Then I pay 40%. United Healthcare pays 60% until my $2,250 plus my 40%, as well as anything else I've spent during the year, adds up to $8,550, which the deductible is included in that number. At which point I pay $0, 0% of the cost. United Healthcare pays 100% for all covered services for the rest of the year. All right. So this is, again, one of the bigger differences between these gold and platinum plans. The gold plan you see is a per day copay here, 5 days, $800 a day copay. Surgery is $500. Over here on the platinum plan, you have a percentage, but your out-of-pocket maximum is so incredibly low at $3,500. So this platinum plan is really great for someone that knows they're going to have a lot of claims. You would max out your plan at $3,500. So really, really good plan to have a low out-of-pocket maximum. You'll notice for family, the number is double. This term embedded means that no one person in the family unit pays any more than $2,250 or $8,550. So the example here I like to give is if me and my daughters are on this plan and I get in that car accident and I'm in the hospital for a month, I will have met my deductible in full for the year at $2,250 and my out-of-pocket max in full at $8,550 for the year, and my daughters would have the other half of the deductible and the other half of the out-of-pocket maximum. So think of this like a specific maximum. No one person pays any more than $8,550, and then no combination of the family expenses shall exceed $17,100. Okay, so that's those different numbers. If you're enrolled by yourself, these second numbers don't mean a thing in the world. Here's our PPO plans. We'll start with the HSA plan. So very different plan design, very different plan all around. So you have a $7,000 deductible. You have a $7,000 out-of-pocket maximum. That's the same $7,000. It's not $14,000. All right, it includes that deductible. Basically what this plan is you will pay for 100% of all services until you have spent $7,000 in a calendar year, at which point United Healthcare pays 100% and you pay 0% for everything. So that's all these 0% after your deductible. So 0% after your deductible also means 100% up to your deductible. Now, that doesn't sound like a great plan, right? Well, the reason why you buy an HSA eligible plan is for the HSA. HSA means Health Savings Account. You can think of it like an IRA for medical purposes. So you take money, you put it into this separate savings account. You can put as little as $0 and as much as, I believe it's $3,600 in 2021, into this tax deferred account. Now you put $3,600 in there and you use that for medical services. You can use it for dental, you can use it for vision, you can use it for a lot of different things. And if you don't use it at the end of the year, you do not lose it. It is not a use it or lose it deal. So that's different from traditional like FSAs where you predict how much you're going to put in this account, and if you don't use it at the end of the year, you lose it. With HSA plans, that's one of the great benefits is it's an individually held account. It is not use it or lose it. And it's a nice little tax advantaged account for those of you that might want to take advantage of legally putting a couple more bucks away pre-tax. The trade-off, of course, is you are going to be spending all of the money up to $7,000. So if you're super healthy and you never ever use your plan, this might not be a bad idea for you. Also to note, this HSA plan does cover preventive care. So your annual physical exam is covered at 100%, just like any plan we sell. So there's a $0 copay for all preventative services. So that's the one thing that you get prior to meeting the $7,000 deductible is your annual physical exam. We have a silver and a gold PPO plan, as you can see here. Pretty easy to understand. $1,750 higher deductible, a little bit lower deductible here for gold, $500, $8,500 out of pocket versus $7,800. Copays are a little bit lower on the gold than the silver. So really, if you want a PPO plan, you want that because you want the freedom of choice. You want to be able to direct your care. You want to be able to go to Dr. Jones for this and Dr. Smith for that, Sharp for this and Scripps for that. This is the plan. You will want one of these PPO plans if that's what you value in your health plan, is the flexibility, is the choice, is self-directing your care. The PPO plans will be great for that. Your silver PPO will be lower cost, but a little bit more out of your pocket when you use it. Gold plan will be a little bit more premium on a paycheck to paycheck basis, but your benefits are much better. Dental and vision, we've got several different options with dental and vision. We have 3 HMO plans, bronze, silver, gold. The bronze plan is going to be very, very inexpensive, and it's a perfect option for someone who says, I just want a couple of free cleanings a year and that's it. Silver and gold is for someone who says, I need a couple of cleanings, but I also need a little bit of work, and but I don't want to spend a lot of money out of my paycheck. HMO dental plans are super affordable, but with that reduction in premium comes a reduction in provider groups, meaning there's less dentists for you to choose from in an HMO dental world than there would be in a PPO dental world. So keep that in mind. If you've got somebody that you're very, very interested in seeing, a dentist that's important to you, you might not find them in the HMO network, whereas you could possibly find them in the PPO network. So that would be a reason why you would consider going with a PPO over an HMO. The HMO plans are the only plans that cover orthodontia. So if orthodontia is something that's important to you, you have a copay with the HMO plan, but not with the PPO plan. Here's our PPO plans. We got silver, gold, and platinum. Our silver and our gold PPOs are our traditional Delta Dental PPO network. Silver is going to be the cheapest. The calendar year max. This is one thing I want to point out to everybody. PPO dental plans, unlike HMO dental plans, PPO dental plans have an annual calendar year max, which is the opposite of what we talked about with medical. With medical, we said once you hit the max out of pocket, you're done paying and they pay 100%. However, with dental PPO plans, once you hit the calendar year max, you pay everything else and they pay nothing. All right. So that's why these calendar year maxes are important. All right. Silver plan also puts your endodontics and periodontal needs into the major category, meaning it's a 50-50 split versus 80-20. And what this means is when you go in to get preventative care, the Delta is going to pay 100% of the cost. When you go in for basic services, Delta is going to pay 80% of the cost. Major is 50%. But the big difference here is endo and perio is in major versus PPO gold and platinum. They're in the minor or the basic category. Last note here, the PPO Platinum actually uses Delta Dental's Premier Network, which is one of the largest networks in the country. So if you really want a major amount of choices of providers, you're going to want to go with the Premier Network, the Platinum plan. Our vision plan, we have 2. These plans are identical in almost every single way except for one specific one. You see the arrow pointing to the 12-12-24 and then with Platinum 12-12-12. What that means is this. It means that that first 12 tells you how frequently you get that $10 eye exam copay. And with Gold and Platinum, it's every year. The second number is how frequently you get that $25 copay for lenses. And with both plans, it's every 12 months. The third number is how frequently you're going to get that $180 allowance for frames or the $150 allowance for contact lenses, or I said not and, or 180 or 150. With the gold plan, it's every 2 years. With the platinum plan, it's once a year. So really, this is the only difference. I love the platinum plan. This is the plan I want everybody to buy if you want vision plan. If you want a vision plan. If you don't have needs for vision, I would just waive this benefit completely. But if you are going to buy vision, buy the platinum, because the platinum plan will cost you about $24 a year more in premium per year, and that's pre-tax. And in exchange for that extra $24, you're going to get an extra $180 in tax-free benefits every year rather than every 2 years. So it absolutely positively pencils. Both plans are good. Both plans have the same exact network of vision providers you can see. The platinum plan, just to me, is a little better value. All right, so our enrollment portal is healthyminds.ease.com. I'm going to be sending out an email to everybody. It looks just like this here. You're going to get an email, and now open employee benefit enrollment portal, mandatory, deadline 12/4. Again, this is mandatory. Everybody must log in and do something. You do not, it's not mandatory that you enroll. It's just mandatory that you log in and either enroll or decline. So this is exactly what the email will look like. You'll press login here. You'll log in. For those of you that are signing in for the first time, you're going to be asked to choose a password. Choose a password and save that. When you get in here, you're going to see it just like this. You're going to see open enrollment. You'll start enrollment. Let's give you an idea of what you're going to find here. Here's your overview. Now, when you guys log into this, you'll see this presentation embedded into this box right here. So if you wanted to see any portion of this presentation over again, you're able to do that by clicking right there. Otherwise, you just continue. You're going to add all your information here. I usually have all this done. I apologize. I hope it doesn't take too much time here. Now, I like to always suggest that you enter in your dependents, and the reason why I'll show you in a minute. But it's, if you have any dependents, kids, spouse and kids, put them in here. Putting them in this dependent category here does not mean you're enrolling them, but what it does do is allow you to toggle between enrolling by yourself, enrolling plus family, enrolling plus you and your spouse, whatever it may be, and you can very quickly see the rates for everything. Medicare, if you're on that, go ahead and add it here. If not, go ahead and continue. Benefits. So now, right off the bat, it's important to right here select. You got to select the enrolled or the declined. Now, if you decline, it's going to ask you for a reason. Okay, let's enroll for myself. Let's decline for my kid. Now, if I know it's with Anthem and it's this ID number, great, but also this works here. Okay, so if that's what you need to do, then that's what you need to do. If you have this information, please do submit it and put it in there correctly, but I do not want it to hold anybody up. I don't want to slow you down. So right here is where you'll see all the plans and all the per pay period prices for how I've enrolled. Okay, let's say I want the Harmony Gold plan here. You see it's $120.70. Now check what happens. Look right here as I'm going to enroll my child. So the numbers change instantly. So I can tell very quickly that adding my child is going to be another $128 per month. And that's too much, or that's just enough, or whatever it is for you. So you can make that decision, check that plan. Each one of these benefits are going to have multiple links underneath them. So if you want some more details on your plan, you can find that here. You can download it, you can print it. There's a provider link. There's a video tutorial. So I recorded a video tutorial on YouTube that will walk you through how to find a doctor with United Healthcare, because you are going to need to do that down here at the bottom, because you have to choose a primary care provider. I'm going to walk you through it very quickly here with United Healthcare. So you click that link. You go down to physician, hospital, healthcare facility, medical directory, all United Healthcare plans. Here's where you're going to scroll down. It says, what plan are you looking for? For those of you looking for an HMO plan, Doctor Network, you're looking for the signature value plans. Signature value harmony is what you're looking for. But right here, signature value tells you HMO. And for those of you looking for PPO, it's Select Plus. All right. So we'll go ahead and select signature value because we're looking for a primary care doctor, medical directory, California. Here's where we're looking for the name. We're looking for Harmony, Harmony, Harmony. Boom, Harmony. There it is. Now we just go with, put your zip code in. I'm going to go ahead and put that one. It's going to give me a whole bunch of options here. People, places, services, treatments, care by condition. I'm looking for a primary care doctor, so I'm going to go ahead and do that. Primary care here. All primary care providers, cast a wide net. And then I see 459 within 20 miles. So let's reduce this down to 5 miles. Okay, now let's reduce this down to only 5-star patient review people. All right, Howard Wynn is the Howard winner, and we're going to choose him. So what we do now is we take Howard Wynn MD, boom, right click, get back to our plan here, scroll to the bottom, name, paste. Now we want the ID number. You're going to find that right here, provider ID, and here it is right here. Right click, copy, we're back to it, boom, and paste. All right. You also have the ability to click this auto assign button. Now, clicking the auto assign button just tells the insurance company, go ahead and assign a provider near my home. I don't want to spend the time looking for it, or I don't have a preference for it. Maybe this is what auto assign means. As a note, if you choose to auto assign, you are able to change your provider at a later date. You can change your provider every first month of the year. You would just call your member services line, let them know that you're looking for a new provider, and they would find that for you. So we'll say Howard Wynn's my current provider. We'll move along. Again, our numbers are tracking right here at the top right. Once we've figured that out, we're going to hit continue. Dental, let's enroll both. Let's choose the Delta Care PPO Gold. Now, you see, if you choose a PPO, nothing happens down here. There's no asking you to choose a provider. But if I choose the Silver plan, again, numbers are changing instantly on the right, and now I have to provide somebody. I have to provide a primary care dentist. I can also auto assign. We'll go ahead and do that here. Continue. We have vision. Let's enroll just me on that one. We're going to waive my child. I want the platinum plan because the insurance guy said that's a better value. Okay, now I see my total per pay period cost. I'm okay with that. I'm continuing. Here's my summary. You can print your summary here. You can go back if you wanted to add, if you didn't want your child on dental, you can edit it, go back. You can also click benefits and it'll take you right to it. Okay, so we'll go back to summary. We're good with everything. This is where you're going to double check everything is how you want it. Missing information, so I didn't put my scheduled hours, so I just click that. Go all the way back to my scheduled hours. Sorry about that. Boom. Continue. Go back to sign form. It's going to say test child is missing a social. All right. So we'll go back to that and we'll do this. Is that enough numbers, hopefully? Save. Now let's go back to sign forms. Once it's all done, it'll let you just hit this sign forms button. You're going to do this just like DocuSign. There'll be a typed signature and there'll be a signature using your mouse. And so first we'll go with our typed signature, next, and then we use our mouse and we do our signature there. Yep, next. And then it's just going to take us through all of the applications and click all the buttons there. And for those of you that want to be thorough and want to review the application, you can scroll down and you can see everything you need to see here. Once you're done, hit finish signing. And then the last thing I need you to do is hit this finish button at the top right. Now you're all done. Now in your email inbox, you're going to find an email that says, thank you for submitting your benefit elections, blah, 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 blah. That's how you know you are all done. Couple things here on using this system throughout the year. If you want to come back and see what you got going on and what you enrolled in, you can do that with profile. Benefits is going to give you a little more detail on what you got. You can check all these. You can click these links to find a provider. So if you want to basically throughout the year, if you're trying to start to figure out how to do most things with your health plan, I would recommend you go to Ease. You go to healthyminds.ease.com and you log in, and then you go to benefits and you can check any of these links again. Or in documents, I've loaded in a whole bunch of really great things. This first one I'll talk about is the Health for Me app. This is the smartphone app for United Healthcare. There's truly nothing easier or better for you to do to improve your benefits experience other than download this thing. So if you want to do one thing that will have a meaningful impact on your feelings and thoughts and experience with your benefit plan, it will be download this application. How do I find a doctor? What does my plan cover? I don't have an ID card. Where's the nearest urgent care facility? How do I research my claims? All of that stuff is answered right here with the app. So that's my little plug to do that. Employee assistance program. You guys are all mental health professionals, so you understand where we're at right now in the world of mental health. So this is another tool for you guys. If you want it, it's an employee assistance program. This is a 24-hour, 7-day-a-week support line that is free, that is good for anything from marital issues to financial issues to struggles with drug and alcohol addiction. Great resource, a great place to start if you don't know where to start otherwise. And then, of course, there's a bunch of other things embedded into here, including a pharmacy home delivery brochure for those of you who are on regular prescription drugs. Doing this by mail will not only be convenient, but it'll save you money. With home delivery, you get 3 months of your drug for the price of 2. So good option there. And that's your enrollment portal. I'm going to go back to the benefit presentation and wrap up by reminding you that Friday, December 4th is our deadline. If you decline this coverage or if you miss this deadline, you're not going to be able to enroll until next time this year unless you have a qualifying event. Okay. Questions and answers. I'd love to hear from you if you've got any. And here's my contact information right there along with Tamara's. I appreciate you listening to this whole meeting. I thank you for the honor of being your benefits broker, and I look forward to hearing from any of you. Otherwise, stay safe and have a great rest of 2020, and let's get going with 21 already. Thank you.